For me, total worker health and health and productivity are areas that I've been interested in for years, and I never miss a session on any of those subjects.
I'm looking forward to the latest updates in public safety medicine, medical review officer work, independent medical examinations, and commercial driver medical examination.
There are also issues on fitness for duty, which are always of interest to clinicians.
I'm particularly excited for a topic this year about oil and gas. There's a lot of oil and gas mining that has been going on in Colorado, and I think it's important to highlight workplace hazards and trends in fatalities and other injuries.
The environmental health sessions are one track that's been not a great focus over the last few years, and I was really delighted to see that there are increasingly more submissions in environmental health, which is a really important aspect for this college and for the future of our profession.
There's a session that is on the list right now about management of pregnant workers. That I think has some unique educational components and looking at the science to be as protective as our workers as we can while allowing them to do their jobs.
We're going to talk about reproductive health in the workplace. We're going to have some wonderful historical presentations that pertain to the Colorado area. Talk a lot about beryllium and silica when it comes to new standards and perhaps standards that are a little bit more out of date. Some controversies in key fields in fitness for duty like commercial driver medical exams and medical review officer. Learn about what's new in public safety medicine. I think those are some of the things that I'm looking forward to.
I was also really pleased to see some of the sessions that focused on wellness and also professional development. Many exciting sessions.
I'm a member of the federal military section, so a lot of the things that we've been talking about, particularly as it relates to deployment exposures and occupational health effects related to exposures, is certainly an area of importance and interest to me.
We spent a lot of time planning on issues such as medical marijuana and also prescription-controlled substances that people can use in the workplace legally, but may present some safety concerns for the employer. How do we recognize, how do we help people safely use those medications that are prescribed, and how do we recognize when people are misusing or abusing those medications, and then how to help them?
We will be talking about climate change and how occupational medicine providers can lend a hand in making a difference.
We're focusing a lot on the environment, a lot of the issues in our environments and how environmental medicine physicians, which is a part of our specialty, really look to help reduce the impact of those environmental hazards on workers and the environment. And we're going to be talking a lot about wellness. How do we promote wellness in working populations such as drivers, for example, where we have opportunities to help them with sleep and fatigue and with modifiable lifestyle factors such as how to prevent high blood pressure and diabetes and the like.